Welcome back to the Practice Pulse, where we help private, medical, and wellness practices scale their revenue and patient lifetime value. We help them by implementing smart systems, and today we have a truly inspiring guest who is disrupting the mental health space with technology. Michelle, also known as Mickey Coffino, is an award-winning entrepreneur, a licensed professional in the wellness space, and the founder of Generational Health, a revolutionary mental health mobile application. Mickey, thank you so much for joining us.
You're so welcome. And I'm one of the founders, but I've got two partners that I work with, and we can go into that at a
Sure.
later. But most of the goal for all of us together is to inform, educate, and inspire entrepreneurs to the whole next level and what goes into mobile apps and mental health.
Yeah, absolutely. Well, we had a fantastic introductory call, and we
Mm.
even did a partial podcast recording where we had some technical issues. So we're back again. So
Yep.
I know a little bit about your personal journey and some of the work that you've done, and especially specifically with the Second Chance program and how it's deeply influenced this app. But if you don't mind, could you tell us a little bit about your background, and then if you want to dive into the other founders and their backgrounds and kind of how you,
Sure.
a 360 degree of how you got here?
Absolutely. So I have been a licensed hairdresser and owned a spa and salon since I was 18. I got licensed at 15. When I opened up my salon, I got really fortunate that I had a lot of different people in different, business acumens, different types of platforms. And it gave me the ability to meet someone that had actually been in the scrap business for over 25 years, and they just, like a lot of entrepreneurs, bit off a little bit more than they could chew, and with that bite came a lot of confusion for them, and it just was financially not a good space. And they offered me the opportunity to buy their company out of the bankruptcy courts. So with that, when I bought my scrap business, I own now two scrap yards,
Oh,
one
wow.
in Charlotte and one up in the outskirts of Charlotte, and I started a 501(c)(3) second chance program. With that second chance program was mental health and taking people who are currently incarcerated or coming out of incarceration. And most of the people who have been incarcerated, if they're not mentally ill when they go in, they will when they come out.
Yeah.
I have a daughter that struggles with mental health, and I've got another child that struggled with addiction in the very beginning of their journey. They've been clean for 8 years, clean and sober, and they're
That's
just
awesome.
doing fabulous. And it gave me an insight having a firsthand lens of dealing with mental health, trying to get appointments, trying to get time to get to the appointments, trying to get continuity, trying to get services. When my daughter would have struggles, it was constant running to the emergency room. That was an all night thing. I would go days without sleep trying to get people to service my daughter, having her go into a treatment facility, what took place to get that, how to get the services, which is what led myself and my partners to develop generational health. They were like, we need to get something where everybody has access. Well, what I learned is three things people need: a lot of time, and everybody's got a phone.
Mm-hmm.
Even if they're in Medicare, Medicaid, urban areas, everybody's got a phone. So we came up with the technology to develop a mobile app that has guardrails that integrates a AI companion, which at this level of this AI companion, it's above ChatGPT 5.2, and it's above Genius for if people are using different types of AI platforms to communicate with. So I integrated that with very strong guardrails. We integrated a verification system for Medicaid, Medicare, health insurance companies to verify instantaneously with the blink of an eye.
Mm-hmm.
We integrated DoseSpot to be able to get people to, if they needed to get medication. So we're a HIPAA compliant mobile app that integrated as well as a backflow, but the ability for people to verify for medications. So we can actually write prescriptions through the mobile app to go into your preferred, if you do Walgreens, CVS, Walmart, whoever you use, they'll
Mm-hmm.
have the ability to get their meds and have it fully operational for people. So I took into the busy mom, the busy entrepreneur, the busy business owner, the mom who's got three jobs, who's got kids. So we integrated DocuSign So if their children need mental health services, they'll be able to sign, verify, and their kids will be able to get on and use their services. And I found kids to be a lot more preferentially working with a mobile app. They're just
Mhm.
on top of it. They are way ahead of the curve of people who are elderly, but we made the mobile app so easy that people in elderly homes, people in senior living, people who need just maybe grief counseling, peer support, drug addiction, alcohol. So we could put up to 15 people on a call at the same time. So
Oh,
we've
wow.
integrated so many moving pieces to this mobile app that it's not just a telehealth. It's actually you get to name your companion. You have access 724. Every time you communicate to that companion, it's HIPAA compliant. It'll literally flow back into the doctor. So guess what? The doctor can literally communicate, see everything that's going on to follow the algorithm
Mhm.
of the patient. So we'll be able to have the ability to see what they are doing every day when they communicate with that companion. And these guardrails are up at such a level that we request you share your location. So at any time that we've got a college student, we've got an adult, we've got a child that communicates any type of dangerous behavior, suicide communications, or any type of harm, self-harm,
Mhm.
it'll immediately dispatch out for the patient services for medical attention. So automatically you say, I want to kill myself, and your location services are on, it will dispatch out emergency
Oh, wow.
services. So I looked at people who had shared about their kids in college or their kids
Mhm.
in high school or their parents at home suffering from grief. We'll be able to dispatch and possibly maybe save a life.
That's
So
amazing.
that was a big thing for me because I saw what the dispatch time is when you call 911 or 988. And it could be in some cities like Los Angeles, I'm having something go on. It could be 2 hours before they get emergency
Wow.
services dispatched. So,
Yeah.
and that's coming from people that were gracious enough to share with me. Yeah, I called 911 because we thought we were having, my daughter was going through a crisis. They said it was an hour to get somebody out. So now we'll have the ability with this to dispatch emergency services because we're talking about the loss of a life.
Yeah. That's amazing.
It's pretty advanced in the technology. So I think having ChatGPT, Gemini, different AI companions patented up this backflow so the doctors can have access of everything that the patient's sharing, what they're going through in a mental health space. And it's a lot of people don't understand mental health has definitely different layers of what you're dealing with. It could be addiction, it could be
Mhm.
depression, anxiety, it could be family members, it could be grief. And the goal is to have somebody to talk to. And I
Right.
think that's where people don't understand. You can take them to an emergency room, but if they're feeling at this level, it could be all night and you may not get services because they don't always have someone for them to talk to. So then you've got to wait in the emergency services. So our goal is to have access all the time.
I love that. Um, so from the practitioner's side, so we're talking
Hmm.
about if I have patient, I'm a practitioner, a mental
Uh-huh.
health practitioner, and I have patients, and I want to
Yep.
see what's going on. How does the generational
Generational health.
health app, how does that AI companion and patient dialogue tracking specifically help a busy practitioner have more
Sure.
effective data?
Here's what's great. Usually, and we're going to do a slight hypothesis. You drive to the doctor, you sit with the doctor, you give an hour of your time to the doctor. Then the doctor's going to go back again, review the notes of everything you've stated that you need to help with. I'm struggling with this or I'm struggling with that. The great thing is, this companion is going to gather all the information, deliver it to a backflow, condense down what the client shared, and say, this is what we're going to say. Her name is Jenny. Jenny came in, Jenny shared at 10 o'clock, 12 o'clock, 2 o'clock, 4 o'clock, gather all the data, share it to the clinician, condense it down, and say, these are the footnotes of what the patient has shared. Plus, she can read it if she'd like, but it's condensed down. So the time efficiency for the clinician, they've got
Mhm.
all the information before they even get on the phone. And then when they get on the phone, they can say, well, I saw your companion shared. These are the things that you're struggling with, whether it's drugs, alcohol, depression, anxiety. Maybe it's just a postpartum. It could be so many number of things that the patient shared,
Mhm.
and they'll be able to track that algorithm. So when they get on the phone, they're actually looking at the problems, and then they can go into, here's what I see. And what we've also integrated into this companion is it can give you, like, let's just say you're talking about coping skill sets for cutting or drinking or drug use. It can give you different things to work on to help the patient. So it can give them little side notes. It can't give them a treatment plan, but it can give them some coping skill sets to work through till they get on with the doctor. And that's really the key to this success is how do we get the patient's results? So since that doctor's going to have access to all those records when they get on, they can start doing the touch points for a treatment plan for the patient. So I think it's going to cut down on the time savings for, I don't think I know. You're going to cut down on treatment time for the patient, treatment recommendations for the patients, and start the actual plan as you go along.
I love that. It's nice too because it's also it allows the practitioner, the doctor to really focus on the human aspect and the patient care
Correct.
because they have all of that kind of information consolidated and upfront and
Mhm.
especially in between sessions. I love that you talked about, this is a good way to keep a pulse on your patient in between sessions. So it's not necessarily to replace a therapist, but gives the therapist the ability or psychiatrist the ability to tap in
Nancy,
when they're
you
not
just
there.
just hit the nail on the head. I think so many people are trying to extrapolate out the clinician.
Mhm.
The Chat GPT, the Gemini, wasn't developed to be the therapist. It
No.
was developed to actually gather the information and give it some insight, not treat a patient. And our goal is to give all the information to the clinician so we actually can have a treatment plan, not make it so 7/24 you're seeing a doctor every single day, but you don't have a plan for success. We want to get the patients treated and literally get a successful treatment plan.
Mm.
And I found a lot of people, especially people who have children, to get services, they don't have time. But everybody gets a lunch break, everybody gets a break, everybody's got a phone. So imagine that 30 minutes on the phone talking to your AI companion, delivering to the doctor. Then you get on with the doctor. Hey, I read that, Susie, everything you've shared. Here's some plans. Let's start this platform of these type of events and start a plan for you to implement
Mhm.
in your daily healing for your issues that you've shared. And as it every time you log in, that doctor's going to see if we got somebody with maybe mood disorder. Do we need some dialectic behavior therapy? Do we need possibly something to help you, whether it's a type of medication or maybe it's your diet?
Mhm.
Maybe a lot of people don't realize if you drink a tremendous amount of coffee, you eat a lot of sugar, all of those affect your ability in processing because your blood sugar goes up and
Mm.
down. It could affect your moods. It could affect your anxiety, your depression. If you smoke a lot of cannabis, what are you taking place? And the best part, it's HIPAA compliant. So it's a very safe space for patients to be able to share their information. And that was really one thing a lot of people don't understand if they're using these AI companions and you're talking freely, it's not a safe place. Anybody can access what you talk about, what you
Mhm.
share, and it can be used against you.
I think that's a really important thing to highlight too, because I know the current generation, the younger generation is really tapping into the Chat GPT or Gemini and
Mhm.
using it as a therapist and not
Yep.
realizing the implications that they could have from doing that.
Well, imagine if you were going to work for a company and then they say, well, let's have some access of their records. They can access anything
Mhm.
anymore. It's not a safe place. This is HIPAA compliant. So guess what? You can't access what you've discussed with your companion that you've named. And we let people choose the name of their companion. And when it backflows to a doctor, the doctor's got a code to access that patient's records, and it's secured by the doctor. So that's a really good platform for patient safety. And I
Mhm.
think that especially kids who are going out of college or people that are going into the job market, or maybe it's something to do with employment, you really want to make sure that what you talk about is secured and safe for you and your doctor.
Yeah, absolutely. Let's talk a little bit about how this app bridges the gap between the clinician and and the and the patient. So you mentioned the app integrates with critical medical services. You
Yes.
mentioned DoseSpot, P-Verify, Comet Chat, and SureScripts. So tell
Yep.
me a little bit about how those specific integrations facilitate a more seamless and efficient interaction between the user, the AI, and their
Sure.
human healthcare provider.
Absolutely. So the clinician gathers all the information, they deliver it to the psychiatrist. The psychiatrist makes an analysis by what current meds that they have, what current meds that they are taking, if it's blood pressure, blood thinners. And we integrated this so I don't have to worry about the doctor ever missing anything. So, for example, I've got a diabetic and he's taking blood pressure medicine and he's taking something else, but the psychiatrist wants to write a prescription for a certain type of Adderall or Vyvanse or something for anxiety or depression. I don't have to worry about any kind of drug interfacing
Mm,
or allergy because I've integrated it into the mobile app. And that's really the key, that I've put safe rails for the patient and for the doctor. So the doctor's fully aware of what the patient's taking, what prescriptions he's on. And on top of it, if we're going to change medications, they're going to know, hey, look, they already took this medication and these were the outcomes from the medication. And these are the side effects that they had, maybe tired, gained weight, whatever it may be. And DoseSpot, which is what's integrated into this platform, so
mhm.
we don't have those issues. So we've got the rails up for the patient and they'll know exactly what they've been taking over the tenure of their time when they in, because you'll have to add all that into when you sign up for the platform. It'll
Mm,
ask, are you currently taking any medications? And the P Verify takes again another layer. The patient doesn't have to verify their insurance, doesn't have to verify, it'll do it for them. It literally integrates into, you're with Medicaid, you're with Medicare, you're with United Healthcare, Cigna, whoever your insurance provider is, and it'll tell you if you're verified with that insurance company. So it lets us know you
nice.
have. If I've got people, and a lot of people don't think about this, that are emancipated, all
Mhm.
they have to do is upload their emancipation forms and their Medicare, and it'll do all the work for us. So
Nice.
literally, we can get serviceability within the blink of an eye. And the Comet chat gives us the ability for our telehealth. So if they don't want to do video conferencing and they want to do phone conferencing, we're in a secure platform to be able to communicate to the patient, and the providers have the ability to go into a backflow secured office to see everything that's going on.
Nice. Very nice.
It's super cool.
Yeah. So you talked a little bit about the different guardrails that are up, but can you just specifically explain the difference between discussing trauma with a general AI and discussing it with generational health AI, which is designed with
Absolutely.
these specific guardrails to provide that safe environment?
So the sandbox was about a 7-month build.
Mhm.
And what we did is we integrated Gemini, ChatGPT 5.2, and another AI put forth. So in the sandbox, we continually kept pushing the sandbox, testing the sandbox on a patient level. Like what are the things that will flag the AI on it? Anytime there's self-harm talk, anytime there's something about, depression, anxiety, and not wanting to be here, not wanting to live, all these guardrails that come up, or overdosing, drug use, it's going to flag the clinician and
Mhm.
it'll dispense out anytime you're speaking of taking a life, losing a life, or not wanting to be there. It's going to ask you, are you safe? And in this app, we've put it up where while you're using the app, your location services are on. You can deny that, but if you deny that and you start talking to the companion and there's any type of self harm or anything on that, it'll automatically flag, are you safe? Where are you at? So we can make sure this patient safety is first and foremost, which is really important in mental health. As you well know, what's just taken place recently with family members not making it. And I don't know as though people understand most of the hurdles really come from they don't have anybody to talk to. They have
Mhm.
no one at that moment in crisis. So our goal is that we build a safe, humane place for somebody to talk to 724.
I love it. It's great. I mean, the stuff that you've built out is really innovative, and I think it's really gonna help a lot of people.
It is.
Can you talk a little bit about the ability to name your AI companion? It's a really unique feature, which I love, but
Yes.
there's kind of a psychological impact that it has with that
Well, I
personalization.
can't I can't take the credit for that one.
Okay.
So, one of my partners in generational health, who's very worldwide famous, and that the reason I felt like he was an integrated key piece to this platform is he lost his brother live on Instagram and he committed suicide. So, mental health is a big platform in his next move, and he's had some real struggles himself with, losing a family member. And on top of, mental health is a real issue. That's why put our logo is it's okay not to be okay.
Mm,
I think a lot of people don't realize when people do have mental health or struggle with personal issues, it's not only an hinged place to be. The judgment that you put on yourself, oh my God, what are people going to think? I struggle with this or I struggle with that, whether it's an eating disorder, drinking, drugs, depression, anxiety, whatever you struggle with, everybody's got an issue. Maybe they just don't feel safe enough to talk about it. I've got a professional athlete that I'm really good friends with. He goes, prior to a game, Mickey, I really feel like I'm going to have a breakdown. I'm so stressed out for the performance levels. So the partner that came in with that, he said, let's make it so they can name their own companion because I think that if it's a trigger and we name it, what if that name is something that was a trigger for them? So, for example, one of the patients, they named their AI companion Morpheus because they loved the Matrix. I have another one that named it their grandmother. I had someone
aw,
that named it. So I think you want to have that. There's this serene feeling of coming together with your companion.
mhm,
And the companion is not to treat, it's to gather information, share that it's okay that you're not feeling okay. And it's going to ask you every time you log in, how are you feeling today? What's up? How are you doing? What can I help you with today? It's really to be an assistant and help gather a safe place to share
mhm,
what you're feeling. And I think that's the hardest part is to be real and authentic and share what I loved about the companion. And a lot of people don't think about this. Think about this. If you feel any way how somebody looks at you, how they're interfacing with you, you pick up on those vibrations and that energy. The companion's always going to be positive. There's no reading a face, there's no reading eyes, there's no vernaculars that you're picking up on. They sound upset, they seem anxious, they seem mad. Nothing. It's always going to be a positive goal to make you feel safe. And
right.
that's really what we want.
Right. Yeah, that's awesome. I love the building that in there because I really do think having the ability to name your companion really creates a for a lot of people can create a connection that they wouldn't
A big
otherwise have.
connection.
Yeah.
Yep. That's why I
You
have
mentioned your
generational health.
partner. Are you able to tell us a
Sure.
little bit about
Oh,
your partners?
yeah, 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 yeah. So
Alright.
my first partner's John Kirk. It's DaBaby. He's a rapper, and he's done a nationwide tour, and I loved his energy to help inner city urban
Mhm.
communities and give access to everyone. Everybody should have access to mental health. And I loved his passion to want to make a difference for humanity. And he said, listen, I was young. I've made some mistakes. I've said things I'm not proud of, but that's not really who I am. And I think that the best part about a second chance program and the best part about anything is knowing that people do make mistakes. That doesn't mean they always think that way or feel that way. They might say something and then be like, I don't even know why I said that.
Yeah.
We've all done it. We've all
Oh,
stepped in a
yeah.
big pile of something and be like, I don't really think that. And I love that he can admit that he made
Mhm.
a mistake. And I love that he's like, I want to be better than I was yesterday. I want to be better than I was 2 hours ago. Every day is a strive to be better than he was. So that was leaning in to, he's getting ready to do a Netflix series
Cool.
it's really good. They're talking about the benefits of having therapy and struggling with mental health and what it's meant and how it's done and how he really wants to take and make a difference in people's lives because he knows the mistakes he's made. And some of them have been at a very big cost,
Mm.
either getting canceled socially or getting canceled in his environment or whatever. And now he's on the upswing to want to be a better version. And I think he can make a large impact on young people.
I love that. That's
Yep.
awesome.
And my other partner had served 5 years in prison for trafficking
Mhm.
cannabis, and now it's legal, which is even funnier. And he said, the struggles that I had I known what I know now, but isn't that hindsight when you're 20 to
Yes.
45? So I think the best part about, I think that's why I love having a second chance program is everybody might make a mistake, but it's how do they change the mistakes?
Mm.
And do they want to make a difference in where they were, whether it's 25 years in prison or a day in jail. If you make that step to consciously change the trajectory of the journey, that in itself speaks a lot of volumes to me.
Yep.
I
I
don't think you should,
completely agree.
well, I don't know as though we should, as humans, punish people for the rest of their life for one mistake. If
Mhm.
they made a mistake and they're taking the steps, and my friend said to me, well, what about people that do it over and over? I said, that's a different ledger that you need to
Mhm.
work on. But I want to focus on the ledger of if you've served the time for the crime, it's time for you to be able to make a difference. We can't punish people forever. That's like a
Yeah.
child. You can't spank them every single day if they're trying to make a difference.
Yeah, and I think our system too is so focused on the punitive as opposed to rehabilitation that we struggle
Yes.
a lot with creating an opportunity and an environment for people to come out of the prison system as a better version of themselves. So I love that. I love the idea behind your second chance program. Could you tell just a little bit more about what that entails, the second chance program,
Sure.
and then also how it kind of led you into
Dovetails
this
in. Sure.
mental health app?
So when I started my scrapyard, I had a lot of people come in and they really, you could see they struggled with either mood disorder, bipolar, highs and lows, and they'd be different each time they came. And then as I watched them and I'd had discussions, a lot of them had served time in prison. And I said, so how did you get into the scrap business? What made you decide to go down that way? And they all said the same thing. Nobody would give me a job.
Mm.
I served in prison, whether it was a year, 5, 10. One of my guys that's worked for me for 15 years to serve 25 years in the state of North Carolina penitentiary. He just retired and he said to me, nobody would hire me. And I said, so, and the crazy part was he was riding in a car with somebody that robbed a bank, but he had an assault rifle on his lap. Didn't
Oh,
harm anybody, didn't go into the bank. He just was riding in the car and he got
yeah.
25 years. So I guess my journey to this mental health app was he couldn't take off time from work because you could only see a clinician 9 to 5.
Mhm.
Well, we work from 8 to 4:30. Then he talked about, the actual access to get services. Didn't have it, but everybody's got a phone. So now we've got 724. I've got this companion gathering this information. So when he took his lunch break, he would be able to jump on, talk to the therapist because they've got all the information. So
Yeah.
that's the purpose to create time efficiency. CEOs of companies are like, oh, I don't want to walk into a doctor's office and people see me walking in and think I got something wrong with me.
Mhm.
There's another thing. We've taken away access 724. We've taken away people knowing where you're at because guess what? You can go in your car and go on the phone and
Mhm.
nobody sees where you're going. So that anonymity is there plus the safe space. So that second chance program really led me into seeing how we can change the trajectory of access. When they shut down all these mental health clinics, people didn't realize that shut down access for a lot of people that don't have the mental faculties to be able to utilize mental health services. Now we can go and sit on these helpless encampments, grab their phone, download generational health, walk people through the steps that maybe if they need meds, they'll feel a lot safer to get back
To
on
get
them.
them. Yeah, that's amazing. I love hearing specifically about your journey and how you got to where you are because you're so multifaceted and you have so many different ventures and you're just like to me the epitome of holistic, right? Because you
Yes.
kind of you hit all the different markers. Tell me a little bit. We talked about the guardrails and you talked about how we can have safety checks. But tell me a little bit about kind of what the app does. Like how does it what do the guardrails entail? Like what happens if someone says something that maybe has a suicidal like does it respond and send help?
Yes.
What does it do?
It'll start out with, "Are you safe?" Then it's gonna when your location services are on, it will speak with the person on the other end, like, "Tell me what you're thinking, how are you feeling?" But anytime you have any type of self-harm, it's going to dispense out the minute you speak about it. And if you don't have location services on, it's gonna ask, "Are you safe? Can I get somebody to help you?" If you don't respond, you don't give it your location, you don't give it self-help, it will ping a doctor on the back end of it because the
Mhm.
location services are off that we have a crisis situation, and then we'll look up and have to call in to get somebody to do that. And hopefully, we don't ever have that coming through because we've set it up and the companion will stop engaging. It won't allow you to continue forward because the guardrails. I don't want the purpose of the companion is to assist the doctors, not to treat the patients.
Mhm.
Does that make sense? So if
100%.
they start about self harm or wanting to kill themselves or harm somebody else, and their location services aren't on, it's going to ping. We have a crisis situation, and it'll stop the communication for you to keep saying, I'm going to kill myself, I'm going to kill myself, or I'm going to, self harm myself. It's going to stop and allow you to continue writing that, and it'll dispense and ping a doctor.
That's awesome. I think that's just so important. You talked a little bit in our intro call about, it is a financial load to start an app. So,
Oh, yeah.
what kind of advice would you give to other entrepreneurs in the wellness space who are developing kind of innovative, high quality products, but they lack the financial backing to do so?
Well, first thing you really got to look at is what space are you going in? What's the competition? Have there been people already in that space? Are you going into a space that's, got 35,000 apps in the same space that you're thinking about doing that? Because
Mhm.
that means people know you, people flow you. How are people going to find you if there's 35,000 other apps doing exactly what you're doing? So there's one thing to look at before you start to build an app. Second of all, you've really got to look at who's going to build the app for you. How much experience are they in that space? How well is their knowledge in getting it across the finish line? Apple's very difficult when you're trying to
Mhm.
get it finished out. The company that we chose has been in the medical mobile app space for 15 years. They're highly seasoned. They understand what goes into the credentialing, what you've got to integrate in and be able to make sure all the coding and everything is going to pass through and still support my app after we've been approved in the app store. So as the needs and the changes come, they'll
Right.
be there for you. But in the cost analysis space, depending on the type of app you're building, they can run anywhere from 5,000 to $300,000 to a million. Just
Mm.
depends on what you're integrating and what type of app you're building. We built a pretty sophisticated integrated app, so it was a pretty big cost to the company, but I didn't want to cut any corners and I wanted it to be exactly what my needs needed, what
Mhm.
my patients needed, what my employees needed, and we're always there to serve us. And that was really important to me.
I love that.
I said I was a single mom of triplets. Time was a big factor in the thought process of this mobile app because
Yeah.
people who are moms, dads, parents, anybody that's got kids, you don't have as much time. as people realize, because you're working full time and you've
Mhm.
got children, plus dealing with mental health, addiction. It's a lot. So I really wanted it to be where everybody could access it.
Wow. I did not know that you were a mom of triplets. My
There you
goodness.
go. Don't tell anybody.
Oh,
After
it's
I
out there
just
now.
expanded out. Exactly. My friend said to me, "Was that hard?" I said, "I don't think I do anything different." Now looking back on it, thank God I had ADHD because I could do it all day long.
That's how I
So
feel
it was right
sometimes.
my
I'm
nose.
like, if I didn't have ADHD, I don't know that I would make it through the day, like getting
Day.
everything
Yes.
done that needs to be
Talking
done.
on the phone, watching an email, reading a text, watching your kids, mopping the floor, washing a dish. You're
Yeah.
always doing something,
Something,
but it's
yeah.
all in the great
Several
faith.
somethings.
And I really hope that the goal for anybody that's in mental health now feels safe, now can have access, and most importantly, actually get a treatment plan and
Yeah.
start the process to be better than they were yesterday.
Yeah. That's the ultimate goal.
It is.
Do you have any new features that are kind of in the works for generational health right now? Anything new and upcoming that you're excited about?
I think the most exciting part is that we've made it accessible. So you download it, you can start your companion, start your communication, and run. And I really, really hope that running with the companion will literally service the doctor a quicker response time for a treatment plan for the patient, not
Mm,
constantly seeing a doctor with no treatment plan.
that's awesome. So
Yes.
the app is up and running
It's
and it's available, I'm assuming, on Apple and Google Play? Is
Yep,
that
we're in
okay?
all of it, and literally download it, play with it, talk to it, see how far along you come just with the companion to feed to the doctor. And the great place is you're safe. Whatever you say, nobody gets to hear or see.
Is there a different, way that clinicians can get access
Yeah,
to that app? Is there
the
a
the the clinicians will have a backflow when they work with us,
okay.
and they'll be able to go in and actually see on the backflow of what the patients are talking about.
So how do clinicians contact you to get that set up?
Anytime clinicians are looking for something that's in a telehealth space, or if they live where our corporate headquarters are in Charlotte, North Carolina, obviously they can come to work at where we're at, and it's just state of the art. I can hardly wait for people to play with it and see if they actually have a health and wellness step.
Yeah, that's awesome.
Yeah,
Well,
I'm
great. Well,
excited.
I will, we'll have the notes, I'll have the name of the app, and I'll see if I can pull a link to it as well and
Absolutely.
put that in the
It's
notes.
generationalh.com.
Generationalh.com. Okay, great.
Yep.
I will put that in there. Are you on social media as well?
Yes, we are. We have my name, Mickey Coffino, for my personal, and it's Generational H1 for Instagram.
Okay.
And we'll start once we get moving and start making our video content of what people do and how we do it. It's going to change the whole journey for what people think for mental health services.
Yeah. I'm excited. I'm very
Excited.
excited.
Me too. I'm so
Well,
glad you brought us in.
me too. Well, thank you again for sharing your expertise and
Yep.
your vision. To our listeners, if you're looking to optimize your practices systems and you see how this technology can really transform patient care. So
Yep.
I'll again have links to this and to Mickey's social media, and I'm
Me
really excited
too.
about this app. I think this is,
Me too.
this is the good. I always, when people ask about, thoughts on AI, and some people are skeptical, and I always like, even my kids have brought it up. It's like, you have to look at it as a tool, and a tool can
Yep.
be used for good or for evil. And so
Yep.
this is just a
I think we're going to
wonderful
support
use.
all the doctors. Yeah. Yeah.
Yeah,
Yeah.
I think it's a
I'm so
wonderful
glad,
use.
Nancy. Thanks so much for bringing me on
Yeah.
the show. I loved it.
Well, I really appreciate it. So thanks again, Mickey, and to our listeners. We will
Yep.
see you next time.
Can't wait.